Let's talk about UTIs. What are UTI? You hear that often, that term. It's urinary tract infections. And the urinary tract infection is a complex system. It includes the kidneys, the ureters, the bladder, and the urethra. So when we talk about an infection, bladder infection, it is part of the UTI. What causes UTIs? Typically, there's some risk factors. One being more common in women, just because of the female anatomy. The urethra is much closer, the urinary opening is much closer and shorter to the bladder, so bacteria can easily enter into the bladder. There's sometimes where there's blockages in the ureters or the kidneys with stones, or you're born with these blockages that get worse over a period of time, or you can have cysts in the kidneys where it causes overgrowth of bacteria. There are instances when some people have UTIs after sexual intercourse, which happens mostly in postmenopausal women. We see that quite often. Also, younger women with multiple sexual partners. It's more frequent in women than men. Doesn't mean that men do not have UTIs. And when men start noticing UTIs, it's usually because of anatomical causes like stones, or if they have immune suppression, people with diabetes. In men, we also see if they are having enlarged prostate that causes, outlet obstruction where the urine is just sitting in the bladder, and that causes increased bacterial growth. People who have recent instrumentation or urologic procedures like catheter placements, prostate surgeries, all of them are at increased risk of UTIs. Urinary tract infections are primarily caused by bacteria. Most of the bacteria, interestingly, are bacteria that are in the gut, in the rectal area. So some of them, like E. coli, you would hear the names E. coli, Enterococcus, Klebsiella. These are all gut bacteria. So a lot of times the wiping, when we go use the bathroom, people with incontinence of stool, those who are wearing tight underwear or diapers, that causes an increased risk of growth of bacteria in that area and then ending up in UTIs. Some of the other causes are also using certain kind of birth control methods, such as unlubricated condoms, douches. Also, women, when you use deodorant sprays, locally in the area, some of them cause increased overgrowth of bacteria. To treat it, we usually rely on the urine culture, which is why it's so important when you start having symptoms and you call your doctor's office or you go to the ER, you say, give me an antibiotic. That's all well and good, but there may be instances where there are bacteria that are resistant to the antibiotic. So hence, initially, whenever we give a prescription for antibiotic, we're assuming that it is caused by the most common bacteria, like I mentioned, E. coli. And then we call it empiric treatment. We give antibiotics, but we do require, the best method is to send the urine sample to the lab and have them run a culture on it. That gives us the kind of bacteria it grows. Some with people with recurrent UTIs, and again, recurrent UTIs meaning more than 2 or 3 in a year. We treat them sometimes with long-term antibiotics, where we use a low dose of the same antibiotic given daily, but in long-term for at least up to 3 to 6 months, so that we prevent these infections. It's very important to keep a diary, sometimes, especially if you notice UTIs in sexually active individuals. You want to make sure this is not a urinary tract infection you're getting after intercourse, because if that's the case, there have been times where your primary care doctor or urologist do give you an antibiotic to keep, where you take a single dose after sexual intercourse to prevent the onset of the infection. The other modalities that we use apart from antibiotics to treat is, the most important thing we always forget is to drink plenty of water. What water does is you're urinating a lot more, so it flushes out the bacteria, number one. Number two, a lot of times when you have UTIs, when it's really bad, you end up being dehydrated as well, so you want to prevent dehydration. There is a lot of talk about cranberry. a lot of cranberry juice, historical, and it continues. There has been a lot of research ongoing that is still ongoing. The thought process is that at one point they thought cranberry juice changed the acidity of the urine and hence decreased your UTIs. But then there's also research that shows there's actually no correlation in the improving or the outcome of the infection with cranberry juice. Anyhow, since as all this research is ongoing, it's not harmful. It's drinking more liquid. So if it helps, do it. There's cranberry in multiple forms, in juices and in tablets. Usually recommend doing probiotics. Probiotics are good bacteria. So combination of cranberry with probiotics, you can get them over the counter now. And you can go ahead and do that. Back in the day, I'm sure our grandmothers and mothers remembered, they used to eat a lot of yogurt because of good bacteria. I have patients who say, I'm eating a lot of yogurt, but then it's very high sugar yogurt, and it's not the one where it has probiotics in it. So remember, when you pick yogurt, you pick the one that typically shows that it has probiotics, like Greek yogurt. So at the end of it all, how do we avoid and how do we prevent getting UTIs? Again, healthy lifestyles, keeping yourself well hydrated, making sure that, especially women, sexually active women, to urinate after you have intercourse, keeping a diary of your symptoms and the frequency of UTIs if you have repeat UTIs, avoiding using unlubricated condoms or douches, using local deodorant sprays, wearing tight-fitting clothing, all of these methods, and to make sure that you reach out to your doctor. If you are having more frequent UTIs, more than 2 to 3, then we've got to do other testing as well to make sure there's no anatomical changes.